Hey everyone, thanks for tuning in to RGV Community Health Hour. I'm DJ Kalicha Kid. On today's show, we have a returning guest, Elvia Gibbs. But we're going to take a quick music break and be right back with our interview with her, so stay tuned. Thanks. All right, everyone, thanks for staying tuned in. As a reminder, the views expressed on RGV Community Health Hour are for informational purposes only and do not constitute medical advice. Be sure to consult your primary care provider for all your healthcare needs. All right, as I mentioned before the music break, we're here today with Elvia Gibbs. Elvia, thank you for coming back on.
Thank you so much for having me back. I'm so happy to be here today.
Yeah, of course. So I guess if you want to give kind of, for maybe, this is Elvia's third time on the show. It's actually the year anniversary of the first time I had her on the show, more or less.
It is.
Yeah, and so, I mean, I don't know if you want to give people a quick update on your journey, just like a quick overview.
Yes. So the last time I was actually here, you're right. It's a year anniversary. I think we did it a little bit earlier in October last time because I was about to leave to MD Anderson for radiation treatment. And this time I actually just came back from MD Anderson last week, and I had what they considered the year and a half scans from when the tumor was removed. And so grateful to God that everything was clear.
Awesome. That's great to hear.
Thank you.
Yeah, and you were at MD Anderson last week. You said for the year and a half scans.
Year and a half scan. So basically, the way it works is when you get diagnosed, there's different treatment options that you go through, different surgeries, and depending on what option you kind of went with and what type of surgery you went with, that'll determine kind of how they scan you, screen you, and how they'll take a look when it comes to breast cancer. So I'm speaking about breast cancer. And so due to the fact that I had a lumpectomy, obviously, mammogram screenings are super important, right? Your yearly mammogram screenings are super important. But on the side where I had a lumpectomy for the first couple of years, what they do is they also image that left side, whether it be through a ultrasound or a mammogram. They'll go in and take a look and just make sure that everything is still looking clear on that side. They'll also kind of watch it very closely at the beginning because they're looking at like the changes, right? There's changes to it. I just went through surgery. I went through radiation, and although I didn't feel the radiation, well, it did its work on the inside, right? And so they're kind of looking for that baseline and just making sure that everything looks clear and that everything still looks good. And everything did come back clear and everything did come back great. And so I'm grateful to God. And then you get to work right away, right? You get those clear scans and you immediately just start to focus on everything that you've been focusing on for the past 12 months.
Yeah, so just out of curiosity, since it's basically been, like you said, a year and a half about since you've gone through all that, how are you feeling today, compared to, if you can kind of reflect on your journey and
Absolutely. I always tell people survivorship is tricky because you get that feeling of, I made it, right? Like everything that you just put your body through, chemo, radiation, surgery, and you cross that line, right? That finish line. And it's kind of like when you're in a marathon, right? And you cross it and then you take that deep breath in and you're just realizing everything that you went through leading up to that crossing of that line. And so for me, survivorship has been a little bit tricky, to be honest with you, because I feel great. I'm so grateful, that we have these advances in medicine and that I am taking medication that my doctors, are telling me you take this for X amount of years and your body is basically going to learn to not do what it did before, right? And so we have faith that that is exactly what's going to happen and it's exactly how it's going to work. And then through purpose, and I feel like I keep myself busy. So even when I want to have those feelings of self-doubt, in which I tell people all the time, like your feelings are your feelings to have. They're yours to own and own them and feel them and allow yourself to feel them because it's a healthy way of feeling them. When you think about a cancer survivor, let aside the breast part, right? But you just think about a cancer survivor in general. And it doesn't stop at the ring of the bell. The journey
Mm-hmm.
doesn't stop there. It's not like you're suddenly, that's it, cancer's gone and I don't have to worry about anything anymore. No, like there's so much that comes afterwards. There's medication that comes afterwards. There's scans that come afterwards. There's lab draws. I mean, I just had one this morning, and making sure that it doesn't come back,
Mm-hmm.
right? That there's no recurrence. So there's a lot of work that goes on the end of survivorship. And I always tell everyone, when it comes down to survivorship, like I feel like more than ever, survivors can definitely feel a little bit lonely because everyone just kind of thinks you're okay now, right? Like you're
Mm-hmm.
fine, she's fine now, she's great, she's doing all these things. But no, it's when it definitely matters the most to ask someone like, how are you feeling?
Mm-hmm.
How are you doing?
Mm-hmm.
Because it's not an easy road, and
Yeah.
it's a road that we're traveling for the rest of our lives.
Yeah, and that's why I was kind of curious to see how you're feeling overall
Mhm.
because, it's one thing I was reflecting on yesterday. I was just with my daughter who has Crohn's,
Mhm.
and I'm just like so heartbroken inside knowing that even if she's feeling good, that it's going to be something that she has to kind of deal with for the rest of her life.
Mhm.
And yeah, so that's why I was just curious about how you were feeling.
And it's not easy.
Mhm.
It's not easy. And for the caretaker, right? Like Justin, you as her father, you feel those feelings with her
Mhm.
because you're recognizing and seeing the battle that she's going to have for the rest of her life,
Yeah.
right? And I always tell people like science advances so much on a day to day basis that I have so much hope for all of us. It's not just cancer,
Yeah.
right? For Crohn's, right? For ALS, for
Mhm.
whatever the case is, right? Where we're kind of coming to a stop somewhere right now, but I know that I will live to see the day where it's going to be just like a chronic illness, right? Like
Mhm.
diabetes or something. Here's a pill, you're going to take it, and this is just what it's going to be. And Justin, with you saying that you see it with your daughter, Justin, my husband, he's just so good at holding the fort down.
Mhm.
And I can tell you absolutely, I would not be able to do anything that I do without him. And, for me, it's so important that he gets recognized because he always recognizes my fight. He knows
Mhm.
that I fought so hard so that I could be here with him because I
Mhm.
love him and I want to spend so many years with him. And just to see that he holds me down the way he does, it gives me so much drive, so much fight, and
Mhm.
so much want to say, I'm gonna not just stop at me, I'm gonna fight for others,
Mhm.
because everyone's life matters.
Yeah, that's for sure. And I'm glad you really brought that up about like all our medical, advances,
Hmm.
because that's one thing I was telling my daughter was like, it's hard now, but
Hmm.
it's not a forever thing. Like you might have Crohn's forever potentially. Like of course you can go into remission and
Yep.
and go, be a lot better compared to what she is now.
Yeah.
But it's just kind of one of those hard things that you have to deal with over X amount of months or X amount of years.
Hmm.
But I told her that, she is going to get better. And whether it's through, advances in medicine or just, you know,
Her body becoming receptive to
hmm
what they're doing. And your daughter's story, sharing it, and that's what I tell everybody is sharing your story brings so much hope.
hmm
It really does. Sharing your story, sharing her story, sharing my story, like there's no voice too small or too little, right? And there's so much power when we use our voices because not only does it bring hope, but the biggest and most important thing of it all is it brings awareness.
Yeah, exactly.
And people need to be aware.
hmm
Education is key when it comes down to these type of diseases, and early detecting certain things and not brushing off, certain symptoms, right? Because that's one of the biggest things that we do see too is that people aren't aware of what symptoms can actually come in form of. Not all cancers show up the same way, right? And when that does happen, we need to become aware of what it is that our bodies are telling us and then advocating for ourselves, right? Because a lot of the times it doesn't look necessarily like a textbook, right? It looks
Yeah.
different. But knowing your body and knowing that something is not okay is what allows us to get the treatment that we deserve and the treatment that we should be having.
Yeah, knowing your body is definitely a big one. I mean, I know that most people feel, they know when something's wrong, right? That you can just feel it kind of day to day, like, hey, something's not right today.
Yeah.
And what I tell people, because I only eat once a day most days,
Yeah.
so whenever I do eat, I know exactly how what I'm putting in my body is going to react. So if I end up like tired or just feeling groggy or whatever the case is, I'm like, oh, it's probably from whatever heavy
Pasta or pizza,
yeah,
right? Because
yeah,
it's those
exactly.
heavy carbs, right?
Yeah,
Yep.
carb crash hard.
Yep.
And so it's and actually before it might have been like right at the beginning of my journey. I've been doing this intermittent fasting for probably 6 years now, going
Yeah.
on 6, maybe 7 years.
Yeah.
And I can't remember who it was. It's some famous journalist or author or something. He talked about keeping a food diary.
Okay.
And like how really powerful that is, because there are certain foods that we can eat that react really well with our body and might give us more energy or give us more focus
Yeah.
on our tasks.
Yeah.
And I think from what I remember, he said that pickles for him is kind of like his focus food. So he knows that if he needs to like, I don't know, like really get down and start writing something, like
Yeah.
he needs to eat pickles before to kind of get those,
Okay.
creative juices flowing, pun
Right.
intended.
It's kind of like when people say comfort food. I
Yeah.
can kind of see like that's his focus food. When someone says like, when I'm having a bad day, like this is my comfort food. Like I kind of go to this. Okay.
Yeah. So, and just kind of going back to, like I was saying, just knowing your body and knowing, hey, what I put in and how it reacts. And actually, whenever I was living in Seattle, there was this one, because I have like a busted knee and leg. There was this one beer that I would drink and it would just inflame my knee. It was like the craziest thing ever. And I was like, man, I'm not going to drink that beer anymore, because I know it really was reacting terribly
Yeah.
with my body
Yeah.
and my injury for whatever reason. I found it really like mind blowing, because the next day I'm like, what did I do that
Yeah.
was like physically straining that hurt my knee?
Yeah.
And I couldn't pinpoint anything. I was like, I don't know what I did, but my knee hurts today.
Yeah. It's that inflammation part of it. So, like, besides obviously the diagnosis of the breast cancer, I've dealt with thyroid issues, for a couple of years. And Hashimoto's is what, they diagnosed me with. And there are certain foods that cause me to feel that inflammatory feeling, right? Like I become very, like you mentioned, like your knee, right? Like my fingers, like I'll look at my fingers and they'll get swollen, or
Wow.
like my feet will feel a little bit swollen. And, when I went on a health journey, and it was ironic because I went on a health journey the 3 years leading up to my diagnosis, actually.
Wow.
When I got my diagnosis, I was the healthiest that I had been in a very long time. In
Wow.
those 3 years, I had lost about 82 pounds.
Wow.
Yes, and I had gotten such great control of my thyroid, and I was feeling phenomenal. I was back on the volleyball court, which is something I love, to do and play. And I was back on the volleyball court, and I was at my very best. So you can imagine getting a diagnosis when you're at your healthiest that you've been in a very long time, and then you're being told you have cancer, and it was kind of like a little slap in the face, right? But it goes deeper than a lot of that, and you really start breaking it down to a lot of things. Genetics have a huge, impact too on certain diagnosis, and I think in our community, that's one of the things we do kind of lack as well. I have women that come up to me and tell me like, well, I'm like 30 something years old, but I don't know really how to navigate here. And you're kind of opening up my eyes a little bit, because I've never been genetically tested. But my mom had breast cancer, or like ovarian cancer. And I had 2 aunts that had breast cancer.
Wow.
And then at that moment, I mean, there's a lot of red flags that are waving, right?
Yeah.
Like, this is a person that should more than likely be genetic tested. Because it's not like people think about like BRCA, right? BRCA1, BRCA2 with breast cancer.
Yeah.
It doesn't just stop at there. There's actually other mutations that when you dive deep into it, and I've been diving deep into it, there's so much that's there. And so with the foundation that we have, and I know I mentioned it before, but with the foundation that we have, we're actually in the works and talking to, and I'm sure you're familiar with this company, it's called Natera. and they do genetic testing. They also run a test called Signatera, and Signatera is one of the newer up-and-coming tests that oncologists use for breast cancer patients, and it's super phenomenal because what they basically did was they took the DNA sample inside of the cells in my tumor when it came out at surgery, and they have it right in their lab or their hands, and they draw blood every 3 months, every 6 months, however often, right? And what they basically do is they draw the blood from me, and then they run my DNA up against what was there, and they look to see if the cells are being read.
Wow.
So I met a lady about a month or two ago at Texas Oncology. I had gone in for one of my infusions because I get a monthly shot, and she was there getting chemotherapy. And we talked about this at the last show, was the cold capping. And I know a cooler when I see one in chemo. So I go over there and I'm like, hi, just kind of want to introduce myself. My name is Elvia, breast cancer survivor. What prompted me to come here was I see your cooler. And, she clearly has the cap on. And she's like, yep. And she's like, I'm trying to save my hair. And I point at my hair and I said, well, I know I use the same, company, and I saved 70% of my hair. And she just looks at my head and she's like, how long ago? And I said, been done with chemo for about a year. And she's like, oh my God, you did save a lot of your hair. And I'm like, yeah. So it gives her that hope, right? And her son that was doing it for her was like, okay, this works, right?
Awesome.
And so I just keep going, bud, because, you're doing something phenomenal for your mom. But long story short, she tells me that this wasn't her first round. She actually tells me this was a recurrence. And what picked up the recurrence was the Signatera test.
Wow.
They did the Signatera test, and the Signatera got a hit. It didn't come back negative. It said that there was something possibly there, which then prompted them to do a PET scan. And sure enough, the PET scan lights up in a very small area on her lung, and then a very small area by where her incision scar was from when they did the mastectomy. And being that Signatera picked it up and caught it early, they were able to go in for surgery, and they were able to remove the area that was in the lung, and they were able to remove the area that was by the incision. And then, of course, now they were doing chemo to cover all their bases and make sure that the cells are completely gone at this point. But just to know that a small blood draw could do something to save someone's life, that is now considered a stage 4, but she's able to remove the cancer. It's phenomenal.
Yeah, for sure.
Phenomenal.
And with that, we're going to take a quick music break, and we'll be right back, everyone. So stay tuned. Thanks a lot. All right, everyone. Thanks for staying tuned in. Before we continue the conversation, I'm just going to read a couple of facts that were curated for me to read on today's episode. So the American Cancer Society estimates that in the U.S., there are 316,950 new cases of invasive breast cancer that will be diagnosed in women, and 2,800 cases in men this year. Female breast cancer death rates, and this one kind of blew me away, and this goes back to what we were talking about earlier in terms of advances in our technology and things like that. Female breast cancer death rate has decreased by 44% since 1989 because of early detection and improved treatment.
Love that.
Yeah, that's a huge percent.
Yes.
In 2022, there were an estimated 20 million new cancer cases and 9.7 million deaths globally. And cases are projected to reach 35 million by 2050 due to population age and growth. So that's one of the double-edged swords, right, of having people live longer. Our bodies just tend to break down. Yeah, we're living longer.
Yeah.
But that's one thing they always bring up is, you want a healthy, a long lifespan, but you also want a long health span as well.
Yep.
Spend as many of those years as you can and as best of health as you can. Because a lot of times whenever I joke around, because I always tell people kind of jokingly that I'm going to live to be 350 years old.
Yeah.
at least at a minimum.
Yeah.
And people are like, oh man, but you're only going to be healthy for 70 of those
Yeah.
years if you're lucky. And I'm like,
Yeah.
no, I'm going to be healthy for at least 300 of those 350. But yeah, so it's just, all these remarkable advances. And there's human trials going on right now in like anti-aging type research. And so it's really remarkable stuff in the pipeline.
Yep.
But, just getting back to what we were talking about before, I know, October is Breast Cancer Awareness Month, so I was just curious how you spent your month. I know maybe had some stuff going on with your work, and that's why I was hoping to have you on earlier in the semester, or earlier in the semester and in the month, to kind of talk about some of that stuff. But feel free to share now.
Yeah, no, but what I always tell everyone is your friendly neighbor that will remind you the importance of early detection 12 months a year. So it doesn't take a month for me to bring awareness, because it's important every month. But don't get me wrong, I love that we have a month where, mammogram screenings go on sale, where, doctors are raising more awareness, or hospitals or small businesses, just kind of rallying up together, because the more noise you make, the louder it is. And when it's loud, someone's going to hear you, right? And so it's been pretty busy, a couple of interviews here and there. And the biggest reason why I do interviews and why I'm so grateful that you have me on here is because someone is eventually going to hear what they need to hear, right? And whether that is that I was 37 years old, I had no family history, my monthly self breast exam saved my life, and so if someone is not doing that monthly self breast exam, they could be sitting back and being like, well, shoot, I'm 35 years old. I'm not doing a monthly self breast exam. I don't know anybody in my family either, but she didn't either. Like, what makes me different than her? You're not. Straight up. You're not different than I am. You're not different than the 25-year-old that I met that was diagnosed with no family history. You're not different than the 28-year-old that just got a biopsy. You're not. And so, as ugly as it sounds sometimes, when you got to say it, you got to say it. And what it is to be said is that in our community, we are lacking education, because that lack of education is what leads us to believe that this could never affect us. And the reality is that it is. You gave numbers. It's affecting a lot of us.
Yeah.
And you are no different than I. You are no different than the person next to me at the oncology center earlier. It can very much, affect you or affect your family. But when we become aware and when we have education and when we know that advocacy is key, we can truly make a difference. And, I'm going to live in a world. I'm going to live in a world where I'm going to get to sit back and say the foundation that I started is no longer needed, because we're good. We're right where we need to be. We found what we needed to find, and now everybody is going to be in a good position, and it's going to be cured. I will, and I put that out there. Or, the work that we do with ACS CAN. So ACS CAN, when the foundation got started, so when I was diagnosed, obviously God placed in my heart the start of the foundation. Because of that early detection, it saved my life, and I needed to make sure that it saved others. And then through there, ACS CAN found me, and I kind of got wrangled in. I'm just kidding. I always joke at Cassandra because I'm like, oh, you threw me in the lion's den, right? Like, she just literally was like, bing, let's see what you can do. And I'm a sink or swim. My dad taught us from young, like, you're going to sink or you're going to swim. And so I've always just kind of swam and figured out. And, ACS CAN has opened up my mind in so many ways. So with a lot of people, they're not familiar with ACS CAN, and we are really working hard to change that. So ACS CAN, basically what it stands for is the American Cancer Society Cancer Action Network. It's a nonpartisan arm of the American Cancer Society. And what are we? We're just a group of volunteers and advocates, that are fighting hard to make a change on a federal or state level. And we're fighting for, those resources for patients. We're fighting for those advancements, to secure the funding to make sure that Where in 2025, going into 2026, there's no reason why funding should be getting cut, because why degress when you're progressing? It makes no sense.
Yeah.
If we're getting all these early detection scans, early detection lab draws, early detection tests that are coming, and science is advancing in such a way, it doesn't make sense to say, well, remove funding now and let's just go back to where we were. No, we got to keep moving forward, right? Because that's the only way that we're going to continue to progress. And so in the month of October, super busy with Titi Satas Foundation because we've been getting people screened. We just this past week did, 3 diagnostic mammogram and ultrasounds. We've had a biopsy. We have 3 girls that are in chemotherapy.
Wow.
It's been busy. It's been busy, and that breaks my heart because that's not the type of busy I want to be in. And then in September, actually August 30th, so I'll kind of go back a little bit.
Okay.
August 30th, we hosted our very first Lights of Hope event.
Oh, cool.
Here in the RGV. Cassandra was a part of it. Thank God, because my mind was like, oh my God, what am I doing? But, it was such a beautiful, meaningful evening. My heart was so touched and so blessed by how the community needed that night. The amount of people that came up to us and were like, wow, what a beautiful way to honor those lives that have been touched by cancer. Because it's not just breast, right?
Yeah.
It's all cancers. So people that aren't familiar with Lights of Hope, Lights of Hope is an event where you come together in remembrance of those that you have lost to cancer, those that are currently fighting the fight, those that are thrivers, survivors. You honor all of those that have been affected by breast cancer, or any cancer, I should say, by any type of cancer. And you light up this beautiful lantern that you decorate in memory of that person or in honor of that person. And man, these lanterns were beautiful. They were beautiful. People decorate them. They put pictures of their loved ones. They send messages. And it takes like a little tea light inside, and you light it up. And typically you do them around like water because it reflects. And the night was just beautiful. And the evening was just amazing. And we raised money.
Nice.
Yes, we raised, I can't remember off the top of my head. It was my first year, but I did get like a little pin in recognition
That's awesome.
when we went to DC. And that made me really proud. It made me really proud because it was my first event. And it was just so beautiful that I know next year's is going to be even more phenomenal.
Yeah, I'm sure. I was at the event they did recently in San Antonio along the Riverwalk, and it was just remarkable seeing so many bags put out and seeing so many people interact with them and walking by them. And like you mentioned, just seeing the pictures, like those were some of the hardest bags for me to kind of like, look at. And because obviously a picture puts a more personal touch to it versus, a lot of them are just, have drawings or have names. Yeah. But when you see the picture of somebody, it's just like, wow, that person, went through their
battle.
Through their battle.
The names for me are the ones that I really focus on because the day will come, right, where, you joked and you said you'll live 350 years. But eventually the day will come where we won't walk this earth, right? And I don't want anyone to forget my name. I don't want anyone to forget my fight. I don't. And, all I could pray for is that when they do speak about me, that they say she was a fierce advocate. She fought hard for her community, and she fought hard for her people. So those names, when I see them, I focus on the names because I don't ever want their families to think that they are forgotten. I want their families to know that their names matter, will continue to matter because they're the ones that came before me. They're the ones that led the way to the treatment that I get now. And so I'll always honor those names. And you're absolutely right, though. You see the pictures, and there's someone's mom, there's someone's uncle, someone's dad, someone's sister. And so just seeing them, it's super impactful. It's super impactful. And for a person like me, it just reminds me of the drive that and what we're working hard for, what we're fighting hard for is a future where our children, get to live in a state of advanced medicine where we aren't seeing people leave. And just that statistic, I think you said 44%, of a decrease in mortality in breast cancer patients. It's phenomenal. I talked about a stage 4 thriver that we have in our foundation. I talked about her at another interview that I did this month. And, I said to think that if she would have had this diagnosis in the late 80s, early 90s, someone would be telling her, you have 6 months to live.
Yeah.
And now she's going on a year, and when she's walking, people see her, and they're like, wait, she has cancer? Like, they don't even realize it, but that's because of the advances, and that's why we fight so hard to protect that funding, to protect those bills that can give us, those early detection passes of, well, here's like MSAD, right? Like, that's one of the ones that we were going for. And, that one is crucial. Like, you have a lab draw that can detect cancer 2 years earlier or something like that. It was that they told us. I have the stuff, but earlier than a scan can. Like, why would we not? Why, like, in what world does somebody sit back and say, wow, if we provide this much funding, we could catch cancer earlier? Yeah, let's not. I'm like, excuse me? Like, it makes no sense, right? But unfortunately, we do live in a world where that can happen. And so we have to use our voices to fight hard for securing those resources.
Yeah, no doubt. And with that, we're going to take another quick music break, and we'll be right back, everyone. So stay tuned. Thanks. All right, everyone. Thanks for staying tuned in. Some more, facts about cancer that were, like I mentioned before, curated for me to read on today's show. So cancer mortality is especially high in low-income countries because of limited access to early detection and adequate treatment. For example, the breast cancer death rate for women in Ethiopia is twice that of the U.S., despite a 60% lower incidence.
Wow.
And some ACS resources, they have the Cancer Helpline, services in English and Spanish, and more than 200 other languages. They're open 24/7. There's online chat available at cancer.org, or you can call 1-800-227-2345. There's also Cancer Survivors Network, an online community for patients, survivors, and caregivers. That would be csn.cancer.org. And the Hope Lodge. So, it says here, Elvia can speak. So is there anything you want to mention about the Hope Lodge?
Yes. So Hope Lodge is, man, what can I say? Hope Lodge is amazing. Hope Lodge, helped my family and I. Hope Lodge has helped many people that I know now, right?
Wow.
Because now we're aware of the resources. There's a lot of people that sometimes don't have the option, and they do need to travel outside of the area where they live, whether it is here, whether it is in Eagle Pass, whatever the case is, right? And they do opt to travel outside of the area because they have to get specific type treatment. Sometimes people have to submit themselves to clinical trials. And a lot of the reasons why they don't do stuff like that is because they don't have the means to stay somewhere. They don't have the means to travel. They don't have the means. So Hope Lodge is phenomenal. Hope Lodge will grant you, so it's part of the American Cancer Society, like you mentioned, and Hope Lodge will actually grant you up to 30 days free.
Wow.
That's it. Free. You're there, you're a cancer patient, you're there for treatment. I was kind of like, is there a catch, right? Like, because you're kind of like, wait, what? But no, there was no catch. And now knowing, right, because you personally get to, I don't want to say take advantage, right, but like to receive these services,
Yeah.
right? Knowing that, that's where that power of your voice comes in, because then you start telling everybody else, like, hey, no, like, what do you mean you're getting an Airbnb? Like, my social worker told me about, Hope Lodge, and you could stay there, and then that person tells somebody else, and then somebody else tells somebody else. And so that's where the power is in that. So Hope Lodge is phenomenal. With the foundation, we've also been able to use resources like Extended Stay America. So we had like one of our girls recently that paid $1 a night to stay
Wow.
at a hotel.
That's
Yep.
awesome.
And these are resources that come from the American Cancer Society.
Mm-hmm.
And a lot of the times, like you'll see on Facebook, we talked about this last time, the power of like pages, right? You'll see on Facebook and someone will ask like, hey, I'm trying to get like the lowest type budget hotel. I have to go up to MD Anderson or UT Health or whatever the case is, right? Is there anyone that can kind of help me? And, people will answer and they'll be like, oh, I stayed at this cheap hotel, or I did an Airbnb here and here. And then it breaks my heart to see that not everyone or the majority of us don't know about these resources, right? And so I always jump in and I always tell people, one of the biggest things I tell people when they're kind of like, this is sketch, right? I get it. Like I felt the same way too. Is like, go to fight cancer. What is it? Go to fightcancer.org, I think it is. And you can get a lot of resources there. I was right, fightcancer.org. And so
Okay.
you go there and it actually will show you a lot about Hope Lodge, Extended Stay America. You can even share your story there. There's
Nice.
a lot of information on there. You'll see stuff from like Hope Lodge too if you go there. And so it's awesome. It's awesome. So Hope Lodge, definitely, I will scream it from the mountaintops, to utilize the resources. One of the biggest things through my advocacy that I learned was a social worker. So one of the things that I always tell people is when they're getting diagnosed or they're there for the first time, ask for a social worker is what I always tell them, right? Because that's how you're able to get a lot of these resources. And so, Hope Lodge is one of them that I'm just so forever grateful for. And I'm just so proud of the work that they're doing now in San Antonio. So San Antonio now is going to have a Hope Lodge. I actually got to be at the groundbreaking ceremony earlier this year, and that was just phenomenal. And I feel like it's a little piece of me that's kind of giving back that gratitude that I have for the services that we were able to receive.
Yeah, for sure. Definitely an amazing resource to, and bringing a new one to San Antonio. And I was able to watch online. I don't know if it was on YouTube or where it got pulled up, but just see the whole, I guess the event where all the speakers came on and then you gave your, you talked about your story, and it's really amazing that they're building that in San Antonio now.
It's amazing. And it's well needed. Like I also spoke in Laredo for Hope Lodge. And, a lot of people from Laredo, Eagle Pass, Del Rio, like that area, they leave to San Antonio. They do. And, a lady that I was speaking to there, she said, a lot of the times we don't continue to go get the services that we need there because we don't have anywhere to stay. And, like when you do radiation, like when you do chemo, they can place it like once a week. They can place it once every 2 weeks, once every 3 weeks. So like, traveling would probably be feasible, right? And you can come right back home, which I don't recommend though, because you want to be monitored where you are. But you don't have that option with radiation. I didn't have that option with radiation. So you can just kind of imagine like that panic, right? Like for 3 weeks, I remember looking up an Airbnb for 3 weeks in Houston. I was looking at about close to $4,000.
Wow.
That's a lot of money.
Yeah, that's.
And I always tell people, like, when you look at me, I got cancer money. I'm like, I got deductibles to pay. I have medicine to pay for, but every little bit helps. And so just being able to have those resources and helping is just phenomenal. And I'm just so grateful that San Antonio is now going to have one and just open up those resources even more.
Yeah, and I was at the ribbon cutting ceremony for the UTRGV's, what is it called exactly? The Cancer and Surgery Center?
The one here?
Yeah.
Yeah.
And that was really cool to be able to hear all the speakers talk about, the work it took to actually get the funding to make all that happen over a 10-year period. And but what really kind of surprised me and got me excited for the Valley is that they worked hand in hand with MD Anderson to put it all together.
Yep.
Like MD Anderson was essentially like their consultant
Yep.
and putting everything together. And I was
Yeah.
like just so blown away by that because if MD Anderson is there guiding you on the best practices, it's going to be a great
Number one
place.
cancer center in the world.
Mm-hmm.
And, it is what it is. And so you absolutely know. And, I will tell you as a patient, they absolutely work hard for that title.
Mm-hmm.
And so, like you said, with UT Health having that, and it's interesting you say that. So we have another girl that's stage 4, and she also gets treatment at MD Anderson, and she needed a consult with the local oncologist because she does have to do medication, labs, and stuff like that. And they sent her there. They sent her to UT Health. We did have someone reach out to us from UT Health, and they said they wanted to speak to the foundation about certain ultrasound machines that they have that are like very advanced. I mean, I don't want to use the terms incorrectly, right? But they basically wanted to show us what it is that they have, just to kind of show how their screenings run there. And so that's a huge step for the Valley. A huge step for the Valley.
And actually, during the after event, everybody's just kind of networking and mingling and getting tours of the new facility. I was talking with one of the medical doctors, and he said that basically MD Anderson gave them like a shopping list of all the top like technologies that they could purchase.
Wow.
And then it was up to them to kind of, because, chances are that they weren't able to get everything that
Correct.
was on the list based on budgeting issues. But just being able to have, like I said, MD Anderson to kind of guide them and the best practices and the best equipment and everything to kind of consult and help. That
matters.
Yeah.
It matters. And especially a surgical center, because not a lot of people are aware on this statistic, right? And again, breast is really where I dive into because of my diagnosis. But in the Valley, we have one breast surgical oncologist.
Wow.
One.
That's insane.
Can you imagine? There ain't 10 of us living here. You know what I mean?
Yeah, exactly.
So a lot of the times, that's one of the biggest pushers for people to step away. Because like for me, I can tell you when I was diagnosed, I wanted it out as soon as possible. So I went from having a diagnosis, and then now I understand it as I dove deep into, those statistics as I'm like, no wonder when I tell people how soon it was, they're like, dang, that was fast. I mean, I literally went from getting diagnosed with breast cancer to going into surgery and being told that I was cancer-free in 39 days.
Wow.
That's crazy.
Yeah.
But again, I understand how blessed I am to have phenomenal health care. I have amazing health insurance, and having access to my pick and choose. I got to pick and choose. And I understand that that's not everyone's story.
Yeah.
And, but, and I will say this over and over again, and we talked about Hope Lodge. At Hope Lodge, there was that part that really stuck to me. And, I actually told Dr. Kamal that this is something that he said, and I'm like, it literally fuels me. And it fuels me every day. And he said, where you live and your financial status and the type of health insurance that you have should not get to determine whether you get to live or die.
Yeah, for sure.
And I feel that to my core in our community because it's so true. Just because we live where we live should not get to say what type of resources we get to have. We should have the best of the best because all of our lives matter.
Yeah.
But it takes using our voices. It takes raising up. It takes going to the people that can actually change that and fighting for those rights to get that change. And that's why, nonprofits are important. That's why ACS CAN is super important. And that's why I am so proud to be a part of these organizations that are truly fighting to make a change and to help the community.
Yeah, for sure. So we have about 5 minutes left, maybe a little bit less. So if there's anything you want to promote or talk about or...
Yes, absolutely. So ACS CAN, let's start there.
Okay.
I need volunteers. Give me people. Cassandra, I'm sure she's listening. She's probably like, yeah, girl, yeah. Because we need people. We do. We need volunteers. You don't need to be a cancer patient, a cancer survivor, let's be real, we all know somebody with cancer.
Mm-hmm.
And so if you feel that there's been a tug at you and saying, like, hey, I want to do a little bit more for my community, or maybe you need community hours. Like I know at universities, there's always groups, right?
Yeah.
Where people are coming together and saying, but like maybe you're in that position where you want to do a little bit more. Please, like, we need more volunteers. We need more volunteers. And again, fightcancer.org, right, is where you can get a lot of the information. And I'll give my email address out there. I'm sure Cassandra won't mind, but you could use my foundation email for anything ACS can. It's what I use for, my emails and stuff. So you always can reach Elvia at titistatasfoundation.org. So
Cool.
Elvia at titistatasfoundation.org. If there's anything that is coming to you of wanting to volunteer, whether it is ACS CAN or maybe you're a breast cancer survivor or patient, and Titis Tatas is what's kind of drawing you a little bit and you want to do a little bit more for your community, please, reach out to me. I'd be more than happy to have you join us in this fight. There's power in numbers, and the more people we can get, the better we have a chance at reaching someone else's ear,
Yeah, for sure.
I don't know the same people you know.
Mm-hmm.
So if I give you this information and I give you the possibility of these resources, you're going to go and you're going to tell the people you knew, and now you reached people that I maybe will never reach.
Mm-hmm.
And so that's important. Also with ACS CAN, there's a lot of legislative work sometimes. We do go up to, whether it's on a state basis to the Capitol here at the state. We did that. I think it was February of this year, February of this year, and then September was in DC.
Mm-hmm.
And so, join us in the fight. See how it is that you can, come with us and hear your voice be heard. With Titis Tatas, obviously, early detection. I'll never stop saying it. Like I said, October is Breast Cancer Awareness Month, but this is a truth that I will preach for the rest of my life. And it is that because it saved my life, self-checking, self-detection saved my life, please perform your monthly self-breast exams, And even if you don't do it monthly, if you do it every 2 months, every 3 months, but you're familiar with your body enough to know that if you feel something that you hadn't felt before, something needs to get checked. Because again, early detection saves lives. Advocacy. Advocate for yourself. If you feel that you're not being heard, or if you feel that something that is being told to you doesn't necessarily sit right, you know what? Get a second opinion.
Yeah.
I am a huge pusher for second opinions. Huge. I mean, I wasn't even diagnosed with breast cancer yet. I had already contacted MD Anderson, and they were like, well, what do you want to do with this if it ends up not being anything? I want a second opinion.
Mm-hmm.
Okay, well, we're going to schedule you for the preventative side, and if it does end up being something, then we'll move you. But I was already in line. I was ready to go. I want someone to give me, for God's sakes, the doctor that did my biopsy, she wasn't even the person that did my mammogram and ultrasound. She was the doctor of second opinion.
Oh, wow.
And she looked at it, and then she said, I also agree, you need a biopsy. So I had 2 radiologists look at it, and they both said, this looks suspicious for malignancy, you need a biopsy. So I don't just say it. Like, I practice what I preach, and it saved my life. So if you look at me and you say, wow, that is a story of hope. That is a story that if I were to ever to be diagnosed with something, I would want to be in her shoes, then you really, really need to focus on the preventative side of things, because that is what truly saves lives.
For sure. And some great, advice and words of wisdom coming from someone who's gone through the experience in more ways than one, from being diagnosed and then also advocating and everything. So thank you so much, Elvia, for coming on the show again.
Thank you.
I'm looking forward to, probably having you on again next semester.
Yes.
I think these once every semester catch-ups or twice a year.
Yes.
It's always good to have and to see what's going on. So
yeah. And we'll catch up then, because I'm sure there'll be more to the story.
For sure. So thank you so much. And thanks to your foundation for all the work that they're doing.
Thank you.
And that's all I got, everyone. So thanks for staying tuned in. This is DJ Caliche Kid here to remind you to stay curious, stay healthy, and let's thrive together, RGV.